All right, good morning, folks. It's 11:30. Diane and Kathy, are we all set on your end?
We are ready to start.
Lovely, great, thanks so much. Sorry about the sun shining in on the one little window pane that doesn't have a covering on it. So I'm going to call today's Public Safety and Health Committee to order. Today is Wednesday, March 10th. As you can all tell, we are still continuing to meet virtually, but there are plenty of ways for the public to still be engaged with us as we continue to keep ourselves, our families, and our community safe by meeting virtually. The best place to find out about how to join upcoming City Council committee meetings as well as our Monday night meetings is to visit the city's website at www.ci.missoula.mt.us/webcasts. That will be kind of the central location for where you can make public comment. You can see what upcoming committees there are, and you can choose the link to participate. If you don't want to do that, you could always feel free to leave the city council members a voicemail by calling 406-552-6012, and that voicemail will go out to all of the members of the city council. Or you can always send us an email with your questions, comments, or concerns at council@ci.missoula.mt.us. This committee and all our other committee meetings and council meetings are broadcast live on our YouTube channel, as well as cable Spectrum channel 190. If you are here today for this committee meeting and you would like to make a comment during the public portion comment, you can raise your hand if you're on the phone, or you can just, if you're joining by computer, use the raise your hand function to be recognized. We will quickly do a roll. Diana, I don't know if you want me to do that or if you are set up to do that quickly.
I can do that.
Okay.
Starting roll call, Stacy Anderson.
Present.
John Contos.
I see him.
Here.
Mirtha Becerra.
Present.
Heather Harp.
Present.
Jordan Hess. Gwen Jones.
Present.
Julie Merritt.
Present.
Jesse Ramos. Amber Sherrill.
Present.
Sandra Vasica.
Present.
Brian Von Lossberg.
Here.
Heidi West. I think Heidi West is joining us.
Yeah, it looks like she's logging in. It might just take her a minute to get all fully connected. So we can recognize her when she jumps on.
Okay.
Okay.
Heidi West.
Looks like she might be having some connectivity issues because she just lost the connection. So I don't see her again. So I'll point out when she's on and we'll get going with that because we have
thank you.
Only one agenda item, but it's an important agenda item. And I want to make sure that we have plenty of time. So we do have approval of minutes from our last meeting, which was last Wednesday, March 3rd, which was the appointment to reappointment to the police commission. Is there any changes to those minutes? Okay, without that, those minutes will stand approved. So as I mentioned, and we will have, we have public comment on things not under the agenda, but under the purview of public safety and health. I see one member of the audience joining us. I don't know if they're just here to learn or if they want to make comment. If you do, please go ahead and raise your hand or press *9. Give them a moment to do that while I introduce the first agenda item. First only agenda item today is a fire department update on the mobile support team and introduction of the new health and wellness coordinator. As hopefully most of you all know, we in the last year's budget approved money to stand up and expand a mobile crisis unit with some matching grant money that we received. And we're really excited about all the great work that they are doing. We heard a quick update from them last fall and asked that they come back this spring so we can learn with them as they get out into the field. And they also were recently promoted Mr. John Petrov to the position of Health and Wellness Coordinator. So I'm going to turn this over to Assistant Chief Davis, who I think is hanging out in the very corner of that. Hi there. To turn over for this agenda item. AC Davis, do you want questions throughout the meeting or want to hold till the end? And you're on mute.
Thank you, Stacy. No, if we could hold questions till the end, that would be preferable to us, just to make things move smoother and so we don't hang John up on his presentation that he's got prepared for you guys today. So thank you for the introduction. Thank you for having us. It's our pleasure to be here. For the record, I'm Assistant Chief Brad Davis, Missoula Fire Department, and I am here to introduce John Petrov as our new Health and Wellness Coordinator. The title is more encompassing than the CARES program and our mobile support team, but one of his primary functions and primary responsibilities as a health and wellness coordinator is the program management for our mobile support teams and our CARES program. Some secondary items that he is doing along with that is managing our peer support program here at the fire department, as well as our peer fitness program, and also any other work comp claims, annual and biannual physicals, etc. So everything kind of all encompassing of our mental and physical health here at the fire department. So I'm excited to announce him. He's a great fit for this position, and it's our pleasure to have him promoted into this position. So with that, we do have a quick PowerPoint to just talk about current status of MST and what it's been doing. And I know we've been before you in the past giving you updates, and this program has been a fantastic endeavor. That does not come without some challenges that we've been faced with the COVID pandemic, staffing issues, availability issues due to staffing issues and COVID. I'll let John speak more specifically about that here in just a minute. So, but as we continue our endeavor here at the fire department of introducing these new programs into the CIT world and the CIT program manager position with Teresa, our ARU response, this mobile support team response, and as we continue to build this program and this fire department to meet the needs of this community. It's been a fantastic adventure so far, and I'm looking forward to our further discussions here this spring with the upcoming budget season and this next fiscal year. So with all of that being said, I am here with Teresa Williams is in the room, and Gordy Hughes, Assistant Chief Gordy Hughes, not listed as presenters today, but they are here in the room with me. Just thought I'd let you guys know that. And if you guys have any questions for us, anything mobile support team specific, I'll probably defer to John. Anything CIT or department specific, we got a pretty good field of people here to field those questions. And then also we have Terry is on from Partnership Health Center as the program manager for the MST response from Partnership Health Center side. So I really hope between the 4 or 5 of us, we can answer any questions you guys may have about the program and anything that we can inform you guys on or follow up on. So with that, I will turn this over to John, and I'll let him give his presentation and we'll move along. Thank you.
Good morning, everyone. I'm John Petrov, new Health and Wellness Coordinator for the Fire Department. I'm excited today to kind of see everybody's face and put faces with names because I haven't been able to do that with the COVID stuff going on that much. So this is obviously a new world for me. I did operations 14 years here at Missoula Fire Department. So it's a new world for me as far as the behavioral health stuff and everything that's going on right now. But it's exciting because I do have that operations experience and understand the changes that need to be made in the system. So I'm excited to have this opportunity and then opportunity to present with you or present in front of you as well. We are doing this mobile support team with partnership with Partnership Health Center. So again, Terry is here to answer any questions you might have as well. So if I miss anything, we do have that support as well. If you guys don't mind, I'll share my screen and kind of go through this PowerPoint. I'm just going to hit some high points on this. And then again, if you have any questions, feel free to ask afterwards. Oh, yeah. Sorry, I will get this figured out.
No worries. Technology is a fickle mistress.
I can run calls really well, I promise. Okay, hopefully you can all see that now. So again, we are in partnership with Partnership Health Center, Missoula Fire Department, and us. This is just kind of an update that we want to bring to your attention, like what we've been doing. Currently, kind of our future goals for the program, especially with me coming in new. We had Randy Ocon as the interim project manager, and he did an excellent job setting everything up for us and creating those relationships. Obviously, coming from operations, I have a different vision right now of like what we can do, and hopefully we can implement those changes. Starting out, we have just some basic statistics. So we've been in service since November 16th. Our call duration right now, I have another slide on this coming up, but call duration is average of 41 minutes, and I'll kind of show you where that comes into play next. Total hours on scene of like relieving fire, relieving EMS, relieving law enforcement's been about 115 hours so far, which that's getting them back to their job and doing what they're trained to do. So we're doing a lot of good with that right now. We're 7-day coverage most of the time, from 10 a.m. to 8 p.m. and we run on the van with 1 EMT and 1 clinician. So right now we have 2 full-time EMTs on staff, and then we have 4 clinicians, with some starting here in the next couple of weeks as well. We also have a pretty good support staff with Partnership Healthcare and with myself and the fire department. So it's really, I want to kind of recognize the team and the work that they've been doing more than I want to recognize what we've been doing, because we're just the support for them. For the call duration, so you can kind of see in this little circle graph that it's all over the place. But what this shows to me is that this is a resource that has the opportunity to spend time with people that have those behavioral health crises. So we're able to spend a lot of time with those people. The ones that are 10 to 20 minutes are usually pretty self-explanatory, very, very simple calls, or even call cancellations. But when you go everything above that, that's spending a lot of time and letting the other resources, a lot of times we've seen, and getting them back on the streets doing their job. This next one, I actually had to change this from the PowerPoint I gave all of you. I had per hour, and this is actually Mst Call Hours. So this is just showing that like the time that we're in service right now is doing a lot of good. So this is, it's spread out pretty good. We're active throughout that entire day, with that 2 o'clock to 4 o'clock being a pretty substantial hours that we're in service. That's when a lot of the behavioral health crisis end up happening. So just kind of showing the time of day that we're doing this is really good for the program right now. Our current response that we're doing is a co-responder model. So we are being dispatched to these with law enforcement and fire through 911. And the reason this program started like that was to make sure that our clinicians that normally weren't in a responder type setting are getting that experience as a response resource. So we're making sure that they're safe, making sure that we're kind of taking baby steps and that they're really learning what they need to do when they get on scene. With this also, like gaining experience with EMTs, so they start to learn on Missoula Fire Department and the system in general for EMS around Missoula. So they were new to the area, so we just wanted to make sure they're they're getting the right experience for the system that we're in currently. For the future response, our goal is through working with dispatch and the CIT program and the fire department and kind of what's been going on in the community, that we're working towards a solo response if the call should be that. We're just not really quite there yet. We have to work through training with dispatch, making sure that that they're comfortable with doing that triage and sending us and utilizing us as the fourth, I call it the fourth response resource, because I believe that with EMS, fire, and law, there needs to be a behavioral health response as well. And that's a part of the system that we've been missing, and that's what we're trying to become. So we're working on this. It's going to take some time to make sure everything's in check with the system. So, and then obviously our number one concern is the safety of both MST and the individuals in crisis. So we want to make sure that that's happening on every scene and that we're sending the right resources. So call types that we will be responding to. Again, this is some of the future stuff, and what we've been changing since I've been in the position is we're doing behavioral health, being assistance with law enforcement, EMS, making sure that we're trying to de-escalate. We started working on doing some welfare checks. So if people are not necessarily in crisis, we can go and help them if they need to connect with resources. So if they need a wheelchair ramp or they need something like that, we can go and be those people to take the time and really connect those resources with the people. And that's where the preventative crisis care comes in. We want to be out there in the public. We want to be connecting with the people we see often. We want to make sure we're preventing that crisis, and we'd rather catch it beforehand than let them escalate to that crisis. So also, we are doing a lot of community and agency outreach, just education of what we're available for, and always trying to reiterate that we're a mobile support team and that we're there to support. We're not necessarily always going to be dealing with crisis. We want to be that element that it doesn't make sense for law, fire, EMS to go to. We want to be that team that can really take the time to get the right resource to the right people. Some goals of the MST. Obviously, the jail diversion and ED diversion was a main one. Like we want to prevent that from happening if at all possible. And I think we have the right team to do that right now. They're able to be experts on the scene and really know what the individuals need at the time. So, and again, we're looking to be the support for the system. So that appropriate resource response is a really big thing that we push with the team, is just making sure, like, if we can be of assistance or help, we want to be those people. So, and then connecting those in crisis with resources. You know, there's a lot of follow-up. So we have a case facilitator, a support that, you know, if we need to follow up, she's able to make contact with them afterwards and make sure they're making appointments, and we have that supportive partnership to kind of help us along with those as well. So, and then relieving of other response agencies is obviously one of those system changes that we need to make happen. The last thing, I don't necessarily like finishing off on challenges, but, you know, obviously there are going to be challenges with the new program. Me coming in, I have different visions, and hopefully they're right. And that's why I'm in front of all of you right now, is to build those relationships and hear what you guys are all looking for along with the community. So that in itself is a challenge of just that system change and explaining to people that aren't responders what we're seeing on the streets and how we can be better. And we need to make sure that the education of our responders is happening. So that system change is going to start with them, and it's going to be by calling us to come on scene and take the time to really get that care that's needed. The system-wide change is obviously beyond just the MST. That's going to be with CIT. It's going to be with utilizing our big fire department plan of, like, the change in the community. So that's a challenge for everybody involved. And then staffing, the one thing with staffing that it's a nationwide issue is we're hiring clinicians that they're used to a clinical setting and set 9 to 5 hours. And fortunately we have a couple that are really, really good at this job and wanting to do this job. And we have a couple more hired on that are really wanting to do it. So I feel like even though this has been a hiccup, I think it's going to be something that we're getting the right people in these positions and we're building that team from within, and it's going to be strong when we're done. So, and then finally, I just wanted to put my name and my phone number and my email out there to everybody, so you all have the opportunity to call me. I would love to speak with everybody and get ideas and see what everybody's looking for in this and try to help where I can or explain something if I need to as well. So does anybody have any questions? I guess we'll open up for that, and I'll try to not share my screen anymore.
That's okay. Thanks so much, John and AC Davis. Hi, Teresa. It's lovely to see you at the end of the table. So we will open up for questions. I want to ask the first one, which is, I appreciate everything that you have presented and the amazing work that you're doing, and really, really understand that this isn't a light switch that all of a sudden, poof, it's on and working perfectly. You're building the plane as you're flying it, and appreciate the, challenges that come with that. And the fact that you're doing this in the middle of the pandemic, hats off to you that it's working so well. One of the things that when we spent a lot of time talking about this last summer that we heard from the community is that, having that place for the person who's in crisis to hand off to. And so I don't know if Terry wants to talk a little bit of the partnership health center aspect. I know that that's one of our visions with the Trinity complex that is being built, and the reason why we funded the kind of service coordinator to make sure that things like that were being baked into the plan for that. But I guess, to me, you're kind of like the first step, getting there, assessing the crisis, de-escalating, getting the needs, and then kind of the second part is how to connect them with resources. So would love to hear a little bit more about that.
Thanks, Stacy. I could talk a little bit about that. I think you really raised an important issue that, when people are in a state of crisis or highly agitated, that, to give them several referrals is not really helpful, that they may not remember, or, those things can be intimidating. And so we did put in, to have a case facilitator who would follow up with the person, and try to do this within 48 hours. And we also asked the MST on-site team asks for verbal consent, so that someone knows that someone's going to follow up, and then try to link them if maybe they really haven't seen a primary care provider for a long time, or they need, access to food, or whatever the things may be in the community, that the case facilitator works with the clinician to try to figure out how to get that person connected into the community resources. And, I think we're very committed to that, and also looking at what are good ways to have people respond. Like, often people may not respond to a telephone number that they don't recognize, because you get all those calls about re-upping your car warranty, so that people won't take those calls. And then, so texting or what are ways to make sure that we are able to actually follow up with the person. And we feel really strongly about that's a critical piece in this. And yes, so that's all I'll say about that.
Great, thanks so much. We have council members queuing up, so I will start with Mr. Contos. You have a question.
Yeah, first of all, thank you very much for taking on what you are without a roadmap. I'm sure you're going to learn lots as time goes on. I did have a question about when you respond to some of these phone calls. When do you know to have the police with you or not? How does that work? Because I'm sure some of these situations can be pretty explosive. You have no idea what you're walking into.
Yes, so that's why right now we're mostly dispatched through 911. So our phone number isn't out to the public right now. We're being dispatched through 911 at this time. We have connected with some of the other agencies in town right now that have my phone number, and then I'm triaging a lot of that on my own, just based on the situation and some operational experience myself. So, and that's what we're working through with dispatch, is just trying to figure out how to triage that and make sure that it's the right resource. Did that answer the question?
Yeah, go ahead.
Yeah, so it's mostly up to 911 to figure out what needs to take place.
As of right now, we are a co-responder unit, yes.
Thank you.
Okay, great. Miss Merritt.
Thank you guys very much for bringing us this. I'm always excited to hear how things are going. So I'm really glad to hear the update. And John, maybe in case that wasn't quite clear, I think what John Petrov had said earlier is that they're always being dispatched with law enforcement at this time. And the hope is that down the road, that we'll have enough training in place that when the situations are appropriate, that the mobile support team could be dispatched independently of law enforcement. So I was wondering, John, if you could go back to that slide you had with the graph with the bar chart, because my slow statistic brain didn't quite grasp what that was trying to convey. And maybe you could explain that a little bit more for us.
The pie graph one, is that correct?
No, I got the pie graph. It was the bar chart with the call hours.
Okay.
Yeah.
All right.
I guess when you say we have a percentage on there, what is that a percentage of?
It's the percentage of our calls are at that time. So that
okay.
our percentage of calls are at that time. So it's, yeah, that would be like the percentage of the calls that we've responded on are at that time frame.
Okay, that makes sense. I didn't grasp that at first. Thank you.
I promise I'll get better at this and explaining stuff.
We're happy that you're great at what you do, and we will forgive you for the PowerPoint presentation. Next, we have Brian von Lussberg.
Thanks. My statistical brain is much slower than yours, Julie, so no worries. John, thank you and welcome into this role and all of those things. I just want not a question for answering now, and I know we're short on time, just an affirmation that when we dedicated funding to this, there was an understanding about the data collection and how important the data collection would be, and you guys are doing that, and I just want to affirm the importance of that. And as additional data is collected, I think what council, well, I'll speak for myself, what I'm looking for is, and this is kind of similar to Stacy's question and comments, where are the weak links? Where do we need to bolster resources? Where are things, where is our opportunity, going forward to expand and improve? And I feel like what we saw today is a great start in that regard in terms of the data collection and assessment. So I wanted mostly to say thank you. Please keep doing that. One other quick plug, and that same comment, Terry, I'm really glad to see your feedback about the opportunities and challenges that you're facing in this partnership are critically important for us to understand. And lastly, Teresa's there. And I know I'm not alone on council, have a very keen interest in the expansion, if you will, of what we can do in the CIT area and how that intersects here. And so maybe a quick plug for the next update to hear from Teresa on that particular topic as part of the presentation. So thank you.
I'd love to do that, Brian.
And Brian, thank you for that. And so as we move into this budget season, we will come with a more prepared data set and presentation and budget. And I appreciate you with those plugs. And I just hope that you guys can share the vision that we all share here at this table and with Terry of this holistic approach with the Trinity Center, with that handoff of care, crisis intervention, CIT, changing our response models from the fire department to better meet the needs of our community and be more efficient with our resources and more fiscally responsible. And at the end of the day, we're here to take care of our constituents and our public, and that's what we're here to do. And so I do appreciate that, and I just hope you guys can share that vision that we have that we're working towards. And it's several different things. It's not just that MST, it's not just CIT, it's not just our ARU response. It's all of those things together that are really going to change the way we approach our response in this community. And like John said it very well, with adding that component of that resource connection and having fire, EMS, law, and a behavioral health response, adding that whole response system and infrastructure is what we're looking at. So thank you for that, Brian. And we will, as we gather this data and bring a more polished presentation to you guys for the future. So thank you.
I saw Ms. Jones had a question, but they have been answered. Okay, great. Well, we are at time, and I did talk to Chief Brandt this morning about getting him scheduled to come in later this spring when y'all have a time to catch your breath, because I know you are also very involved in the coordinated team around vaccines and COVID response. And just thank you so much for all of that you're doing for our community. But we do want to give the fire department an opportunity to come in and do more of a holistic department-wide update and help to give you guys more time to dig into this, because it is such an exciting project. And I really just think that we're at the beginning of some really fundamental paradigm shifts in how we provide care to our community. And once everything is fully staffed and Trinity is built and all of that synergy comes together, I'm really excited to see how we can better serve our community. And just thank you guys so much for your willingness and your continued can-do spirit. It's one thing about the Missoula Fire Department. There is no problem they can't tackle, and same with our police force. So we are very lucky to have all of you here and serving our community, and thank you for all of your work. So we will hear from you more and continue to be well and do great work. So
you're very welcome, Stacy. And I can't leave this meeting without thanking all of our stakeholders and cooperators, the police department, sheriff department, Missoula Rural Fire Department, all of the agencies, mental health agencies, partnership, health center. Everybody's been so cooperative and so helpful in this endeavor. So it's not just the fire department, it's everybody involved. So thank you. Thank you, everybody.
Another example of how lucky we are in Missoula to have such amazing community resources, responders, and people who care. So with that, I will call today's Public Safety and Health Committee meeting. We'll adjourn it, and we'll see you all for Parks and Conservation at 12:15. Thanks so much.